The next bill is one that, Mr. Chairman, you and I have talked about. It's the Lymphedema Treatment Act. This is 1608. I introduced this bill with Mr. Blumenauer. Lymphedema causes painful swelling in parts of the body where the lymph nodes or vessels have been damaged. While there are many causes, damage from cancer treatment is probably the most common. While there is no known cure for lymphedema, it is treatable. But sadly, Mr. Chairman, current Medicare law leaves patients without access to treatment items they need to manage the swelling and prevent further health complication. My bill will fix this by providing coverage of doctor-prescribed compression supplies. This will not only save lives but improve patients' health, but it also will strengthen Medicare program by reducing costly hospital stays. For example, Sarah from Ohio. When she was diagnosed with lymphedema, she was on the verge of losing her mobility and suffered frequent episodes of cellulitis. Between 2002 and 2004, she was hospitalized more than 10 times. In 2005, she was prescribed her first pair of compression garments. By wearing these garments on a daily basis, she was able to maintain the progress she's made through treatment, manage her lymphedema so well that she has not been to the hospital in over a decade. Bob from New York, in 2000, he was hospitalized twice with potentially fatal cellulitis infections. Later that year, he was diagnosed with lymphedema. He received treatment and was prescribed the compression garments. In the 16 years since, he has not had another cellulitis attack and has not been to the hospital. Now, we can talk about whether or not this is expensive, because that's what, of course, the administration's argument is and Medicare's argument is, but we're saving a lot of money by providing these garments to these patients who have suffered through and survived cancer, saving money at the back end on other treatments and hospital stays. And not only that, it is the right thing to do for these patients. So I want to thank members here today who have already co-sponsored this bill. I'd like to recognize the patient advocates who have taken the time to meet with their members and share their stories. Thanks to their tireless efforts, the bill now enjoys, Mr. Chairman, over 230 bipartisan co-sponsors, and now we're working to even get more. And I ask, Mr. Chairman, unanimous consent to enter into the record a statement from the Lymphedema Advocacy Group.
Without objection.
The bottom line here is these are not defined by Medicare as medical devices because they don't fall within the definition of long-term durable devices, which is 3 years, because in most cases, the patients have to have new garments every 6 months. They're not disposable medical devices because they keep them 6 months and not a few weeks or a few days. This is ridiculous, a ridiculous rule, Mr. Chairman, and this bipartisan piece of legislation changes this rule and helps these patients get the treatment they so desperately need. Thank you. I yield back.
Thank you, Sheriff.